Have you ever wondered why, as we get older, we often find ourselves waking up in the middle of the night? Like clockwork at exactly 3 a.m.? You're not alone. Millions of seniors around the world report the same thing. Waking up at 3 a.m., feeling restless, confused, or simply wide awake. And while it may seem like just a small inconvenience, it could be your body trying to tell you something deeper. In today's video, we're going to explore why this happens, what it reveals about your health, and what you can do to improve your sleep and your overall well-being. So if you've been silently struggling with broken sleep, this might be the most important 19 minutes you spend today. The aging body and your changing sleep clock. As we age, our bodies change in subtle but powerful ways, and one of the first things to shift is our sleep cycle. You might remember falling asleep easily in your youth and waking up refreshed without interruption. But now, as an older adult, sleep feels lighter, shorter, more delicate. That's not just aging, it's biology. Our sleep is governed by something called the circadian rhythm, an internal 24-hour clock that regulates when we feel sleepy and when we feel alert. In youth, that rhythm is strong and stable. But as we get older, it begins to shift. Our body starts producing less melatonin, the hormone that tells us it's time to sleep. This is why older adults often feel sleepy earlier in the evening, and why they wake up much earlier, often before sunrise. It's common to fall asleep around 9 or 10 p.m. and then wake up at 3 a.m. or 4 a.m., fully alert, wondering why you can't just stay asleep. This shift is natural, but that doesn't make it easy, especially when night after night, your body seems to wake you like clockwork, leaving you tired, frustrated, and sometimes even anxious. But sleep is more than just timing. It's also deeply connected to your emotions. Emotional weight that surfaces in the stillness. The world sleeps at 3 a.m. The streets are silent. The house is still. And for many seniors, that's when the mind starts to stir. You may find yourself thinking about the past, remembering loved ones, worrying about tomorrow, regretting things left unsaid or undone. This isn't random. In the quiet of the night, when your distractions are gone, your mind and heart begin to speak more loudly. Scientists call it the default mode network, a part of your brain that becomes more active during rest. It's when deep thoughts, fears, emotions, and memories can surface. This is especially true for older adults. With age comes reflection, and sometimes reflection brings pain. Waking up at 3 a.m. may not be just about your body. It might be your soul asking for attention, to process grief, to confront something unresolved, to find peace. It's not weakness, it's human. And understanding this connection is the first step to healing not just your sleep, but also your spirit. Blood sugar and late-night meals. What you eat in the evening may be affecting your sleep far more than you realize. Many older adults unknowingly struggle with blood sugar imbalances. And if you've eaten a meal too late, or one that's too high in sugar or carbohydrates, your body may crash just a few hours later. That crash, often around 2 to 4 a.m., can cause a sudden release of stress hormones like cortisol, jolting you awake. Even something as simple as a bowl of rice or bread at dinner, followed by dessert, can create this sleep disturbance in people over 60. As we age, our insulin response weakens, and our cells become less efficient at processing glucose. That leads to nighttime instability. The fix? Try eating dinner earlier, at least 3 hours before bed, and avoid heavy carbs and sweets at night. Focus on protein, fiber, and light, balanced meals. Also, drinking alcohol late in the evening may relax you at first, but it disrupts REM sleep and often causes early waking. Small changes in diet can make a big difference in your night's rest. The bladder's call. Nighttime urination, one of the most common, and often most frustrating, reasons older adults wake up at 3 a.m. is simple. You have to go to the bathroom. This might seem normal. After all, bladder control weakens with age. But if you find yourself getting up every night around the same time, it might be worth a closer look. For men, it may be due to an enlarged prostate. For women, it may stem from weakened pelvic floor muscles or hormonal changes after menopause. In In both cases, the bladder becomes more sensitive. Even a small amount of urine feels urgent. But frequent nighttime urination, called nocturia, can also be linked to heart conditions, kidney issues, or diabetes. Don't brush it off as just aging. Stay hydrated during the day, but limit fluids 2 hours before bed. And if it continues, speak with your doctor. Sometimes medication adjustments or bladder training exercises can significantly help, because even 1 extra hour of uninterrupted sleep can change your entire day. Medications that disrupt your night, another invisible culprit that might be waking you up at 3 a.m. Your medications. Older adults are often prescribed drugs for blood pressure, heart disease, pain, or anxiety. And while these medications help, many come with a hidden side effect: sleep disturbance. For example, beta blockers can reduce melatonin levels. Steroids can cause restlessness. Diuretics increase nighttime urination. Antidepressants can trigger vivid dreams or early waking. If you started waking up at night shortly after starting a new prescription, this might be the reason. Don't stop taking anything without medical advice, but do talk to your doctor about adjusting the timing or dosage. Sometimes, taking medicine earlier in the day or switching brands can protect your rest without compromising your health. When it's more than sleep, a hidden health message. Occasionally, waking up at 3 a.m. isn't about sleep at all. It's a message from your body. Some medical conditions show up subtly in sleep patterns. For instance, sleep apnea may cause brief waking episodes due to blocked breathing. Atrial fibrillation or irregular heartbeat may disturb deep sleep. Depression or anxiety can lead to early morning awakenings, often with a sense of unease or dread. Do you wake up with a racing heart, sweating, shortness of breath, or an unexplainable feeling of fear? These symptoms should not be ignored. They could be your body's way of warning you, gently but firmly, that something deeper needs care. You deserve answers and peace. Talk to your healthcare provider if these signs persist. How to sleep better after 60. If 3 a.m. has become a familiar hour for you, take heart. There are ways to reclaim your nights. Here are some simple, senior-friendly strategies to try. Set a regular sleep routine. Go to bed and wake up at the same time every day, even weekends. Limit naps during the day, especially after 3 p.m. Create a sleep sanctuary. Dark, quiet, cool, and free of screens. Practice gratitude or prayer before bed. Calms the mind. If you wake up, don't panic. Sit quietly. Breathe deeply. Read or listen to calm music. Don't check the clock or phone. Talk about your worries with a friend, family member, or counselor. Emotional release brings deeper sleep. Above all, be kind to yourself. Aging changes sleep, but it doesn't have to steal your rest. With awareness, small changes, and self-compassion, you can rediscover the healing power of night. Waking up at 3 a.m. isn't just a nuisance. It's a message. Sometimes from your body, sometimes from your mind, and sometimes from your heart. Thank you for spending these few minutes with us. If this video brought you comfort or clarity, consider sharing it with someone you love. And remember, every day is a gift, and every night is a chance to heal.